When babies are viewed to the world, they are often happy to be passed from one person's arms to the next without much fuss as long as they are full, warm, and comfortable. As babies get a little older, though, it's not uncommon for them to begin to fear being passed to unfamiliar arms. Naturally, it can be frustrating when your previously easygoing baby turns into a sobbing, clingy mess when a new babysitter or stranger is in their presence. However, rest assured, this behavior is developmentally normal. Stranger anxiety is the distress that babies experience when they meet or are left in the care of people who are unfamiliar to them. Stranger anxiety is a perfectly normal developmental stage that often begins around 6 to 8 months. Stranger anxiety typically peaks between 12 and 15 months and then begins to gradually decrease as your baby continues to grow and develop. The development of stranger anxiety coincides with a baby's building sense of organization and order in the world. Around the time that stranger anxiety begins, baby realizes that the relationship they have with the people they spend the most time with is different than the relationship they have with strangers and other people they don't know well. As they realize this, babies seek out the familiar and express distress around the unfamiliar. They are distinct developmental milestones. Stranger anxiety refers to a baby's distress around meeting or being left in the care of unfamiliar people, while separation anxiety refers to a baby's distress around being left alone or separated from their parents or primary caregivers. If a child experiences distress when being left with a familiar grandparent or regular caregiver, they are likely experiencing separation anxiety, not stranger anxiety. If a baby expresses distress when approached by an unfamiliar individual or when being left with someone new, they are likely experiencing stranger anxiety. While stranger anxiety is normal and to be expected, the intensity and duration of the distress experienced by any individual baby along with the ways that distress is expressed may differ greatly from baby to baby. Some babies express their distress by freezing in your arms. They may remain very still and quiet with a frightened expression on their face until the stranger leaves or they begin to feel more comfortable around them. Other babies might express their distress in more obvious ways, such as crying, trying to hide their face in your chest, or clinging tightly to you. Older toddlers who are more verbal and mobile might try to hide behind you or express verbally that they want to stay with you or want to hold them. While the research on separation anxiety is more robust than that of stranger anxiety, scientists have delved into the topic. A 2017 study observed that babies who showed a steep increase in fear between 6 and 36 months old were more likely to show increased anxiety at 8 years of age. A 2013 study of twin pairs looked at the many factors that influence a baby's anxiety, in particular stranger anxiety. While you can't prevent your baby's fear or anxiety, especially during this normal developmental stage, you can be aware of how you react to their feelings and encourage positive reactions. There are many strategies you can use to help your baby through this challenging stage with care, empathy, and kindness. Recognize that every child is different. Every baby will warm to people at their own phase. When you recognize that your child's hesitancy to interact with new people is normal, you may be more likely to muster the patience it takes to help them move through the big emotions associated with stranger anxiety. Take practical steps to help your baby feel comfortable meeting new people. This can include introducing anyone new to the baby gradually instead of suddenly. For example, if you hope to leave your child with a new babysitter, you can have the sitter spend some time with the family together first before you attempt to leave the child alone with them. Have the sitter visit with you and play games for some friendly interaction. If you are enthusiastic and upbeat, your child will gather that this new person is pleasant and trustworthy. Use a gradual warm up strategies even with those close to you. It can be especially challenging when your baby acts as if their loving grandparent is a stranger, but these fears are developmentally normal. Encouraging a gradual warm up period to allow for their comfort will make interactions more positive. Support your baby as they experience these big, uncomfortable emotions. Experts recommend that you not ignore your child's distress or pressure them to rein in their response prematurely. Pressuring a baby to go with or be held by a stranger before they are ready can often increase anxiety and make the next time they meet a stranger even more stressful. The development of stranger anxiety can be a challenging period for both you and your child. While your little one is experiencing lots of big, frightening emotions, you might get frustrated that they seem fussy, clingy, or unsociable. Stranger anxiety is normal though, and with the right balance of warmth and comfort, it typically passes before a child's second birthday. As you move through the stranger anxiety phase, remember to be patient with your child, cuddle and comfort them as needed, and try to remain calm and warm as they experience distress. Allowing them time and staying patient through this phase will make for happier days ahead for both of you. If you enjoyed this video, subscribe, like, share, and comment.